G'day everybody, I'm Ted Wilkes. I'm an associate professor these days that works in public health mainly. I have a background in social science. I studied in the social sciences and majored in anthropology and geography in them days, and quickly acquired work in the health field, or in Aboriginal, sort of what we might call the industry of Aboriginal Australia. But I did a pathway which was mine to enjoy. I started working after I did the social science degree in an Aboriginal health service in Perth, and I built that health service up to quite a substantial number of staff, and in a brand new building. We'd worked out of an old shed for many years, and we suffered from the lack of resources. And when Nacho came on board in probably the mid-80s, it was a development from the old NAO, which is the National Aboriginal and Islander Health Organisation, and Nacho being the National Aboriginal Community Controlled Health Organisation. It was commenced in around about that time when I had actually just got out of uni. So I took up this job as the CEO of this smaller health service in Perth. That was about 28 staff there when I started. And now it's a brand new building just down the bottom of where the main health hospitals are in Perth. And it's a magnificent structure. So if you ever get over there, you'll see it as one of the shining lights of the physical AMSs around this country. But there are many others who could tell a similar story. And I'm proud to say that I was there to open that building. It now has well in excess of 120, 150, I don't know how many people work there now, but there are all sorts of things we didn't have. We have dentists, we have social workers, and of course we have doctors, and we have our Aboriginal staff who work in the admin, and also the follow-through of Aboriginal health workers. Some of those health workers have become nurses and doctors. So yeah, had a long affiliation with the Institute of Health and Welfare, and some of the staff here, like the head of the unit, Fadwa Alyaman, I have known her for considerable years now. We've actually travelled around to other places where Indigenous peoples have been colonised by English-speaking people, such as the US, the United States, Hawaii, and New Zealand. So I've done those trips. I've also been fortunate enough to go to places like Brazil and talk using interpreters with Indigenous peoples from Brazil, and I was totally amazed to think, wow, this is a different language that these people, these native First Nations people from Brazil, from the forest, what's that big forest, the Amazon forest, I met with some of those people. And I could see that their poverty was similar to ours. And so I've grown with a wider experience about how all of that's happened. And I guess the questions we need to ask today is, how do we improve the lot of people who have been colonised, have been invaded? Some of us will use other terms like raped, pillaged and plundered, but let's get over that. Let's say that today we still have a discourse that needs us to make sure that white Australia works in with us to give us what is duly our right, and that is a better quality of life. Yeah, there probably isn't a real overarching goal other than to say, as I just said, I'm trying to fashion a pathway into a better quality of life for all First Nations people in Australia. I work with other people like you guys here in this team, and if we can get some momentum coming from the Australian Institute of Health and Welfare, I'm in there. But I also work with communities. I work in the universities. I'm an associate professor with an adjunct position at the University of Western Australia, and I also carry that title quite proudly. I'd like to think that one day I'll complete it and who knows what I'll be in the end of the day. A respected elder, I am that now. I have a big family of over 50 great-grandchildren and grandchildren myself. And so that's a wonderful asset. And, you know, some of those children are going to develop pathways like me. And some of them are quite athletic and playing Aussie rules football. I see some of my young granddaughters won a grand final last year in their local club. So I couldn't ask for more than that. But yeah, my aim will always be to be a significant elder now that I've got the grey hair, and to be a participator in health outcomes and bring on positive health outcomes for our people.